Every time it's me to choose a song. Every time it's me to choose what I hear. Every time it's me to choose my decision. But now why is it me? A whistle turns into a cough. Songs turn into advice. Decision turns into misery. And enjoyment turns into suffering.
Sir, are you okay?
Yes, sir.
What's your name, age, where are you from?
Well, sir, my name is Vaibhav. I'm about 27 years old and I'm from Chennai, sir. Why I came to hospital is because I've been feeling very tired and weak lately, and I've been having many episodes of breathlessness. And during the night time, even when the AC is on, I am sweating crazy.
Have you had any previous episodes of the same?
No, sir. Not any episode.
And sir, any diabetes, hypertension, epilepsy?
Well, sir, at the age of 19, I was diagnosed with latent TB.
Okay. And do you consume alcohol or smoke? Please don't hesitate, sir. Only if you share everything with us, we'll be able to treat you better.
I understand. I'm not proud of it, but during my first year of college, I used to smoke.
Oh, okay. Okay. So, you had latent TB and you're smoking, so you're immunocompromised now, and bacteria will take any chance they get to spread infection.
Alright. So what should I do now, sir?
So what you should do is give us your sputum sample. We'll perform a minor test on it for culture, and then you need to do a procedure called EBUS. EBUS is it's a minor procedure, only 35 to 40 minutes. What we do is we insert a flexible tube into your throat which goes down to your lungs. It has an ultrasound probe and a needle at the other end. This procedure basically helps us finding out what abnormality is there in your chest. Even if you have TB, it will tell us whether you have TB or not. So with the help of that needle, we take a sample from your lymph nodes present in the lung, and then we send it for further examination and investigation to find out what exactly is the problem in your lungs.
What should I do now, sir? Should I take it today itself?
It's imperative that you take it today, because then we can rule out any serious complications in your lung. If there is an infection spreading, it will just help us to diagnose you much earlier.
Alright, sir.
So here's the consent form for the procedure. So please wait in the examination room while we make all your preparations ready.
Sure, sir. Thank you.
Thank you.
What is EBUS-TBNA? Endobronchial Ultrasound Bronchoscopy is a procedure used to diagnose different types of lung disorders, including inflammation, infections, or cancer. Endobronchial Ultrasound-guided transbronchial needle aspiration is a special technique used to take samples of body tissue from inside the chest. What is ROSE technique? Rapid on-site evaluation is a technique for immediate evaluation of samples obtained with EBUS-TBNA. A cytopathologist performs a rapid stain of the collected samples for an immediate evaluation with the purpose of defining adequacy and, when possible, a preliminary diagnosis.
Advance needle through the working channel in neutral position. Secure the needle housing by sliding the flange. Release the sheath screw. Advance and lock the sheath when it touches the alveoli wall. Release the needle screw. Advance the needle using jab technique. Visualize the needle entering the target node. Move the stylet in and out a few times to dislodge bronchial wall debris. Remove the stylet. Attach syringe. Apply suction. Move the needle back and forth inside the node 10 to 15 times. Release suction by removing the syringe. Retract the needle into the sheath. Unlock and remove the needle and the sheath and prepare smears.
Today I'm going to be explaining about ROSE technique, which stands for Rapid On-Site Evaluation Technique. The cytological material obtained are prepared by using both air-dried and wet-fixed smears. The needle rinses for cell block preparations and core needle biopsy are prepared using 10% formalin solution and further stained using eosin and hematoxin. Now, the immunohistochemical stains were performed for cases without overt glandular differentiation for further classification of the tumor. For example, thyroid transcription factor 1, napsin A and P40 are used to characterize primary lung tumors, and other tumors can also be classified using other histochemical stains. Now, we are going to be observing under the microscope to see the pathological characteristics of this ROSE technique.
Good morning. Now, the microscopic features of TB. The inflammation with MTB infection is granulomatous, with epithelioid macrophages and Langerhans giant cells, along with lymphocytes, plasma cells, and a few neutrophils. Lung cancer and its microscopy. To be specific, squamous cell carcinoma. Electron microscopy of the tumor cells in one squamous cell carcinoma revealed polylobulated nuclei and variable amounts of cytoplasm. Here we can see mitochondria in moderate number and different sizes, sarcoidosis. The cardinal histologic finding in sarcoid lymphadenopathy is the presence of numerous confluent, non-necrotizing epithelioid granulomas, which replace the normal nodal parenchyma.
Indications: staging of lung cancer, mediastinal lymphadenopathy, assessment of airway wall infiltration and peripheral nodules. Complications related to the bronchoscopy procedures can be related to sedation for the procedure or directly from the bronchoscope. Complications related to sedation are hypoxemia and hypotension, while those related to bronchoscopy are bronchospasm, laryngospasm, nausea, vomiting, bleeding due to scope trauma. Advantage: improved diagnostic yield, decreased TNBA required per case, better sample adequacy. Tri-aging diagnosis: granulomatous inflammation, AFB special stain, microbiological culture and gene expert. Positive for malignant cells, core cell block, immunohistochemistry, SNAP frozen for molecular studies. Lymphoproliferative disorder, cell block immunohistochemistry, flow cytometry.